Mike Patterson. Today we're speaking with Todd Christensen, CEO of Bingli. Hello, Todd. Thanks for joining us.
Hello,
And
and thanks for having me. It's a pleasure to be here.
absolutely interested in learning a little bit more about your product. With that, why don't we jump in and can you please tell us a little bit about yourself and the story behind Bingli?
Sure. I've been in this industry now for several decades, and I'm always fascinated and have always been drawn to where technology can improve efficiency and effectiveness of care. And there's never been a time where that's more important than in today's world of medicine. I'm a pharmacist by background. I come from a long lineage of nurses, doctors, pharmacists, and I've been in clinical practice, and I think Bingli offers something unique that can really help solve some of the critical problems facing our patients and, more importantly, our providers today. So what we do, Mike, is we have taken we have built the ability to use intelligence to interview patients, collect their medical history, and then we've surrounded that with a workflow engine that helps providers manage an episode of care very efficiently. We do that by using artificial intelligence to triage, diagnose, and manage a patient over time. And I think it's a unique solution that thus far has been very well received by the market. I'm just going to walk through how it works and more specifically what we do. So I mentioned that diagnosis and triage capability. So in the orange box at the top, that is our secret sauce. And what Bingli has done, what our founders have done, is taken the diagnostic reasoning that a doctor, a pharmacist, a nurse, or any other care provider would use when spending time with a patient to understand their problem and the appropriate treatment protocol to manage a patient's problem. We've taken that diagnostic reasoning and we've put it in an algorithm and combined that with evidence-based guidelines. And we ask patients questions in a medical history format. And when we do that, we have the ability to drive a lot of efficiency in many different scenarios. I'll give you some examples. Triage and diagnosis for virtual and ambulatory care providers, where we interview the patients, collect their history, and before a patient meets with a provider or a provider meets with a patient, the provider knows exactly why the patient's seeking care and likely what's wrong with that patient, and they can make that visit efficient and effective. The patients are more prepared for their visit because they've been asked questions that are logical and related to their condition. We also do that for behavioral health care. So we've built the diagnostic and reasoning for spectrum disorders as well. And when we combine that with the triage and diagnosis for medical conditions, Bingli can treat the whole person. Again, a unique and different approach to a whole person based way of managing patients. We have a pre-op and transitions of care use case where we reduce same-day cancellations for surgery and reduce readmissions after a patient has been discharged from the hospital. A biosurveillance capability. So the best way to describe that capability in Europe, where our company was originally founded, we developed an algorithm that can be used to detect asymptomatic atrial fibrillation. Very widely deployed in Europe and very effective in identifying a very hidden condition. And then last but not least, in the green box at the bottom is the ability to manage patients across an episode of care or manage a chronic condition. And we have the ability to do that synchronously via video, in person, or asynchronously via chat or text message or other mode of communication that's effective for patients. The blue box at the bottom is how we engage patients for pre-screening and selection for clinical trials. Also very important in today's era of medicine, where drug discovery and therapy discovery is really dependent upon identifying patients who are eligible for clinical trials. So that's Bingli on a single page, Mike.
Excellent. I do have a quick question, and maybe you're going to cover this. This is with your AI. Do you have any data on how accurate your product is compared to the provider's assessment?
Great question. So we run our algorithm through vignettes over and over and over. And first and foremost, we know that we're accurate between 90 and 96% of the time. That's compared to a human who is accurate between 82 and 85% of the time. So we're at least as accurate as a human and often more accurate. But what's also important is we have this machine learning capability built into the algorithm where we improve over time. So as we collect data and as we interview more and more patients, our algorithm becomes more accurate over time. Also unique and important to build trust between our algorithm and the providers delivering care. A little bit about our mission. So our mission is on the left is really centered around a couple key things that I think resonate with any provider. Our goal is to help practitioners look beyond the obvious, to see things that could be wrong with the patient that they might not see in a normal course of working with the patient. We also know when we do that, that we can boost capacity and efficiency in clinical practice. And I've already talked about the accuracy and the efficiency of our algorithm. So if we do all that, Mike, we know we can offer providers the chance to manage the patient in a whole person centered way. If they can identify and pinpoint a problem that a patient is seeking care for in a visit and quickly diagnose and treat that patient for that problem, that offers more time for that provider to spend with the patient, managing the whole person. The outcomes that we help providers achieve are documented here on the right. We boost efficiency by reducing length of stay in emergency departments, visit length reduction that I talked about just a moment ago. And we know that between 30 and 50% of patients could be triaged to a different level of care. Might be lower level of care, could be a higher level of care. But by doing that history and assessment before the patient appears at the clinic, we have a chance to route that patient or steer that patient to the appropriate level of care immediately. A little bit about how we work, Mike. We are event driven. You cannot download Bingli from the App Store or the internet. Our goal is to support providers. So our clients are almost always providers. And when a patient schedules an appointment, when they seek care, when they contact that provider, we initiate that history and assessment process. That could be as simple as sending the link to a patient in their chart or on their phone and asking them to complete the history, which works as follows. When a patient clicks on that link, they could use their mobile phone. We ask them questions, typically around between 7 and 15 questions. And at the end of those 7 to 15 questions, we have that highly accurate diagnosis. So the algorithm works as follows. We use what we know about the patient from the EHR or from the prior questions, and our algorithm is constantly making two calculations. Number one, what is the most appropriate next question I need to ask the patient? And number two, what are the diagnoses that could be associated with the symptoms that the patient is describing in the prior questions? At the end of the history, we have the diagnosis that we serve up to the provider, along with serious and life-threatening events that a patient provider should assess when they meet with the patient. And when we complete that process, we boost efficiency between 30 and 50%. All of our questions are culturally and linguistically appropriate. We have more than 18 languages, and they are written at the 5th grade reading level, which is the standard for care in the US. So that's how Bingli works, Mike.
Excellent. So this could also be used in an education situation, right? For like medical simulation or med students. And have you all done any, have you used it
We
for
have.
education?
That's a great question. We are deployed in a couple medical schools in Europe for that very same purpose. That's correct. That's a great observation.
Oh, uh, so some basic questions, how about EHR integration? I'm assuming the assessment is done before the patient comes in the room or before the provider comes in the room. Have you integrated with EHRs?
We have, and we use all the standard HL7 and FHIR APIs to integrate with EHRs. For some of the older technologies or atypical technologies, we can develop custom APIs rather quickly. So yes, we have the ability to integrate with just about any source system and consume that information to help feed that history process.
Excellent.
Great question.
Well, and I'm also assuming that I have to ask this, your product is HIPAA secure?
We are HIPAA secure, and we couldn't be in business if we weren't. So we currently have several ISO certifications. We're ISO 27001 certified, which is technology, security, and privacy. That helps us be HIPAA compliant, and we're very conscious of HIPAA requirements. We also are obtaining our certification at this very moment as a medical device. And that's a different ISO certification and required for our business in Europe. More importantly, we are currently in the process or implementing a roadmap for FedRAMP compliance, whereby we will be FedRAMP compliant by May of this year. So FedRAMP takes HIPAA to the next level, and it's a very stringent and structured process that the federal government requires any technology provider who delivers technology services to the federal government to be compliant with. So we'll have that in May.
Excellent. So what does implementation look like? How long does it take, and how does that work?
Usually between 2 and 3 months, sometimes shorter. It could be as simple as a couple weeks, depending on the integration requirements. We have an urgent care clinic provider in the Northeast who is that's a multi-clinic urgent care center where we will complete our implementation in 4 weeks.
Gotcha.
And most of that time is spent testing.
Gotcha. And
For more
support?
complex integrations, it may take up to 3 months.
Sure. Understand. So what does support look like from your company? Is it, how do you obtain support? Do you need support? Well,
Well, healthcare is a round-the-clock business, Mike, as you know, and
Yes.
we have an obligation to support our clients 24 hours a day. So we have a team here in the U.S. that is supporting our current U.S. clients. We have a team in Europe that supports our European clients, and that geographic spread allows us or affords us the ability to provide round-the-clock support easily and readily to our clients. So yes, we offer round-the-clock support with service levels.
Gotcha. And so, um, what is your target customer? You know, are you looking at large hospital systems or small rural
Uh,
areas or everything in between? And
Everything in between. Our mission is to help patients and providers, and we have small clients, a two clinic urgent care provider that I mentioned a few minutes ago. We have a large virtual care client that delivers between 750 and a million virtual care visits a year. We have a clinical research client where we support multiple clinical trials for that client. So I would say all sizes and types of providers that deliver care, large or small. Um, I think every provider needs a Bingli.
gotcha. Well, you know, and having said that, have you done pilots? Or are you open to pilots? Or, you know, I know it costs to, you know, to implement.
Yeah, that's a great question. Of course, we would consider doing a pilot with a client, and our our fee structure is typically based upon number of completed episodes of care or visits. Um, and we would, of course, entertain a pilot. I would also add that we would also consider putting a portion of our fees at risk for outcomes that mutually align our capabilities with our clients' goals. So that's also an attractive model for many of our clients who want to be sure they get the benefit of Bingli and not have a typical provider vendor relationship.
Gotcha. Well, thank you for that. uh, I get it. I have one last question, and you feel free to elaborate more if you need to. But I have just one last question. Where is Bingley headed? What does the future look like? You know, I know AI is it's the buzz term, but where's Bingley
It
headed?
is. It is. I think we're very thoughtful about how we apply AI. We're very transparent about it. We actually provide the output of our AI to providers to build that trust and credibility with the doctors and nurses and pharmacists we support. Um, with the current capabilities, Mike, we support between 13 and 1,500 conditions and those conditions are any conditions that we know we can accurately support a diagnosis for with just collecting a medical history. We see a roadmap where we integrate lab data and even digital device data to expand the number of conditions we can support with our algorithms. So that's a logical next step for us is consuming that external data that would expand our portfolio of conditions. We also see and have examined the notion of a personal health record, and there are numerous examples of personal health records that have been implemented and failed in the US. So we're being thoughtful about it. But with our approach and the data that we collect for patients and providers, it's a logical extension of our capabilities. So we'll look at that in the future as well.
Excellent. Well, this has been great, Todd. I really appreciate your time and giving us an overview of Bingley.
I, I really appreciate the time to talk to you and your audience, Mike. It's been a pleasure.
Excellent. Well, take care. We'll talk soon.